So we are talking about 45 electrohomeopathy points, the application of electrohomeopathic fluids on that area. So basically, point number one is supraorbital nerve. You can see that here. Point number two, infraorbital nerve. And point number three, base of nose. And point number four, bronchial nerves. Five, solar plexus, five, six, seven, all are in same level. Pit of stomach and gastric nerves here, and eight number is crural nerves, nine number is lungs. Okay, and point 10 is angle of jaw. Okay, you can see, and lumbar region, whole lumbar region. Okay, and this is the umbilical region. So mostly in that region, I saw yesterday one case that is umbilical hernia. So you will get the patient. So you will apply electricity on that area. Okay, and we have hypoglossal now. We can see this is the hypoglossal now. Okay, and sciatica. This is the nerve which is coming from the hip, pelvic, hip region, femur, leg, and foot. And this is the arc of foot, 15th number, and occipital. Uh, Hypoglossal, you can define this area, and this is occipital area. Okay, and you can cervical sympathetic nerves here, and spinal, and we have coccyx, and this is the sacral nerves, and the nerves of knees. You can see this is the knee, and you have the number of multiple nerves here, and perineum. So two things are taken, even posterior side of the knee, or else uh, between the reproductive organs around the, and kidney region. You can see that this is the end of the thoracic vertebra near T11, T12, T10, T11, T12. That area you can found kidneys. So one kidney is smaller, some, and one kidney is uh, bigger. Okay, you can see the size here. Next, point number 24, hypochondric region. Point number 25, pubis region. This is the region. And urinary bladder. Okay, heart region, ovaries region, spinal nerves. You can see here dorsal spinal nerves. This is the thoracic area, and lumbar spinal nerves. And 32, nerves of ankle joint. Okay. Now we'll talk about point number 33. So 33 are the flexor muscles of foot. Flexor muscles of foot. These are the muscles of the foot. You can see that this is the flexor digitorum brevis, abductor digiti minimi, abductor hallucis. Flexor hallucis brevis, flexor digiti minimi brevis. So these are the muscles you can see. And flexor means contraction. For contraction, you need muscles. For relaxation, you need muscles. So for that purpose, these muscles are there. So any problem regarding contraction and relaxation, you can apply electricity here. You will get the maximum benefits. And you have mostly ankle twist in that muscle pain is there. Or like here tendonitis is most common. Okay, so in the ankle region, so this is the foot region, so you can apply electricities. So this is the point number 33. Next we have the point number 34. These are the muscles for extension, means relaxation. So these are the muscles. Okay, you can see extension digitorium brevis. Okay, these are phalanges, middle phalanges. Okay, so you can see that. Okay, so this is the extension muscles of foot. And here you can see that what is extension. Flexor means the angle is decreasing. Contraction. Extension means relaxation. You are decreasing the angle. Okay, this is the away from the body. This is you are getting closer to the body. This is flexon. This is extension. Okay, so any problem in that area, you can apply electricities. Okay, this is the 34th point number. Okay, and you have same muscles for flexion, extension at the hand level. Okay, so flexor muscles of hand, you can see these are the muscles also, this muscles also. Okay, flexor pollicis longus, adductor pollicis, flexor pollicis brevis. So any issues regarding flexion and contraction or relaxation, so you can apply muscles to that muscles area. So this is the point. 36 point extension muscles of extension muscles of hand. So this is the number of muscles for hand from here to here mostly. Here is okay. So like paralysis or during paralysis, you can advise the patient, okay, to relax the muscles. Next, 37th point, that is below, above the eye, we have palpebrae superior muscle. What is palpebrae muscles of the eye, which holds the eyelids for closure and open, for closure and open. So what this muscles do to move the eyelid. Okay, if anyone have paralysis of eyelids, so it means that palpebrae muscles have any problem, issues. Okay, this is very important muscle for eyelid. So this is the point number 37. Right side you apply RE, left side you can apply phi. Next to a temporal. Temporal region. This is the temporal region. Any issues regarding temporal lobe, like hearing, tinnitus. Okay, these are the speech understanding. Okay, so any issues like you're gonna have the in this area, you can use that area, you will get the maximum benefit. But temporal region, point number 38. Point number 39 is arc of iota. You can see that this is the arc of iota, this angle. You can see that this is arc of iota. So any issues regarding iota, you can apply electricity. So this is the near the chest region. Okay, near the chest region. Okay, arc of iota. Next we have forehead. So this is the forehead or frontal region. You can see that this is the forehead or frontal region. Okay. So any issue, frontal headache, okay, or we have any issues like walking, motor issues. So you can apply the forehead region. Okay. Next we have muscles here for mastering. So for chewing, so you have the muscles. What are the muscles in master deeper, master superior? These muscles help open your mouth. Okay. So any problems, any issues or buccal issues, but cancer of this area, muscle issues or lock jaw, you can jaw lock, you can use this area to treat the patient. 41 point, 42 point, very important, inferior dental nerves. So you can see that this is the, in this area, we have the number of nerves. You can see that this is the trigeminal nerve. It's the ganglion. Number of nerves are going here, upper part of the mouth. It is the lower part of the mandible area, maxilla area. So they're supplying the nerves to the all the teeth. So this area, this trigeminal nerve, lingual nerve, inferior alveolar nerve, mandible foramen, from that area, it is going to inferior dental plexus. So you have any dental issues, pain, can use that area, okay, to apply the electricity. So this is the point number 42. This is the point number 42. Next we have point number 43. That is the femur. This is the pelvic girdle. We have the femur bone. Any issues regarding femur, you can apply electricity. The okay. And point number 44, vagus nerve. This is the vagus nerve, which is starting from that area, this area behind the ear. This is the area where vagus nerve is entering into our abdominal cavity. You can see that this is the written abdominal vagus nerve. So it's coming, this yellow color nerve is entering into the abdominal cavity and it is reaching the intestine, all the parts of the intestine. So vagus nerve like vomiting sensation, indigestion, or any issues regarding digestive system, you can use this point. Okay, point number 44. Next we have point number 45, last point, that is top of the head. So you can see this is the top of the head. This is the top of the head. So you can apply any issues regarding paralysis, okay, or mental retardation, cerebral palsy, okay, or cerebral atrophy. All these other conditions can use in cerebrovascular disease or any type of clottage out in the brain. Okay, you can use this point or headache, top of the head, you have any pain. Okay, you can use this area. So this is the point number 45. So this is the last point. Okay, basically all our top to bottom, every part is covered, okay, in this 45 points. From the face, we have the point. Okay, on the chest, you have the points. Okay, on the abdomen, you have the points. On the legs, you have the points. Okay, on the jaw region, you have the points. Backside, you have the points. Abdomen and nerves, important nerves. The foot region, whole leg is covered in the sciatica. Back of the head is covered. Back of the vertebral column, whole vertebral column is covered here, and knee also covered. Posterior, anterior, both knee are covered. Kidneys are covered. Liver and spleen and pancreas are covered. Any pubic region is covered, and urinary bladder is covered. Heart is covered. Ovaries, female, male genitals, both are covered. Spinal nerves are covered, dorsal nerves are covered, lumbar nerves, foot region, muscles are covered, hand region, muscles are covered, eye muscles are covered, brain parts covered, important artery, aorta is covered. Okay, all this are covered. Vagus nerve, which is very important in digestive system, is covered. So everything is covered. So I think understood about this things. So this is all about 45 points. So we have to need understood this, and we have to gradually apply this all the applications on that area. So you will remember all those points, and you can easily treat the patient. Okay. So I have understood this is all about 45 points.